Hello students, today we'll talk about sympatholytic drugs or anti-adrenergic drugs or adrenergic receptor blocking drugs or adrenergic antagonists. These terms are synonyms. Now sympatholytic drugs means those drugs which inhibit the activity of sympathetic nervous system. Now sympathetic nervous system, it works upon adrenergic receptors. Adrenergic receptors are divided into two classes, alpha receptors and beta receptors. Later on they have their own subtypes. Alpha receptors have their subtypes as alpha 1, alpha 2. Similarly beta receptors have their own subtypes, beta 1, beta 2, beta 3. So sympatholytic means those drugs which oppose the activity of sympathetic neurotransmitters like noradrenaline or adrenaline. They prevent the access of these very sympathetic neurotransmitters to bind with these adrenergic receptors. So sympatholytic activity or anti-adrenergic activity is possible due to inhibition of adrenergic receptors. Number one. Other possibility, they would lead to inhibition of synthesis of these neurotransmitters, storage of these neurotransmitters or release of these adrenergic neurotransmitters, mainly noradrenaline or norepinephrine. They would also prevent the binding of these adrenergic neurotransmitters, that is noradrenaline, etc., with adrenergic receptors. The result is sympatholytic action or anti-adrenergic action, or you may also call it adrenergic receptor blocking activity. Now these would be classified as anti-adrenergic drugs or adrenergic antagonists, you may also call them. This is pharmacological classification. They can be grouped into two classes, alpha receptor antagonists, beta receptor antagonists. Or we may also call it alpha receptor blocking drugs. Similarly, beta receptor blocking drugs. So alpha receptor blockers or alpha receptor antagonists can be further subdivided into non-selective alpha receptor antagonists. So they may be either irreversible in their activity or they may be reversible. So far as irreversible one is concerned, it is example is phenoxybenzamine, and in the reversible category we have phentolamine, tolozolone. Non-selective means they will act upon both alpha 1 as well as alpha 2 receptor. So it is non-selective. On the contrary, we have now selective alpha receptor antagonists, means certain alpha receptor antagonists, they will act on alpha 1 receptor subtype only. Example is prazosin, terazosin, doxazosin, alfuzosin, tamsulosin. Tamsulosin is also alpha 1A selective. So alpha 1 receptors have further subtypes, alpha 1A, alpha 1B, etc. So indoramine, urapidil and bunazocin, they are alpha 1 selective receptor antagonists. Similarly, we have alpha 2 receptor selective receptor antagonists. Example is yohimbine and rovolcine. On the contrary, we have beta 2 receptor antagonists. Again, they can be grouped into non-selective ones, also known as first generation beta receptor antagonists. Example is propanolol, penbutalol, pindolol, timolol, sotalol, nodalol, levodopa. Means they will block both beta 1, beta 2 receptors. That is why we call them non-selective. Other category would be they will act upon only beta 1 receptors which are predominantly found in the heart. We call them beta 1 selective or second generation beta blockers. Example is acebutolol, atenolol, metoprolol. Then we have again non-selective category. We call them third generation beta blockers. Example would be cartiolol, labetalol, carvedilol, bucindolol. And lastly, we have highly beta 1 selective category, third generation beta blockers, celiprolol, nebivolol, betaxolol. This is among beta receptor antagonists. Now these adrenergic antagonists or sympatholytic drugs can be further classified on the basis of chemistry also. A special mention about labetalol. Labetalol selectively antagonizes alpha 1 adrenergic receptors and non-selectively antagonizes beta adrenergic receptor. This is to be noted. It has 3 times beta blocking activity than alpha blocking activity. So it has both alpha blocking activity as well as beta blocking activity. And next is carvedilol. It is a third generation antagonist. It blocks both beta 1 as well as beta 2 adrenergic receptors. And thirdly, it enhances vasodilatation via alpha 1 receptor blockade. This is something enhancement in case of carvedilol. Then we have nebivolol is highly cardioselective third generation, highly beta 1 specific beta blocker. The beauty with nebivolol is it activates nitric oxide synthesis, increase endothelin dependent nitric oxide and causes predominantly vasodilatory action. Next is these anti-adrenergic drugs or sympatholytics can be classified on the basis of chemistry also. We have a chemical classification also. For example, number 1 is beta haloalkylamine, example is phenoxybenzamine. Imdazoles, example is phentolamine, tolozolene. Quinazolines, example is prazosin and its derivatives like terazosin, doxazosin, alfuzosin, etc. And lastly, ergot alkaloids, example is dihydroergotamine. Thank you. This is the structure of phenoxybenzamine. This is tolazolene, chemical structures. Thank you.